We have an incredible speaker coming up to talk about parasites. I've already given you a bit of introduction about her, and I'm going to go ahead and welcome Dr. Brittni East. Where are you, Brittni?
Hello, everybody. I'm Dr. East. I also go by Dr. Turner, and I'm an exotic wildlife veterinarian based in Fredericksburg. So a little bit about myself. So my husband and I started this company 5 years ago. We recognized a demand in the industry for more experienced exotic veterinarians to come out and help landowners to manage their exotic hoof stock. So we decided to start this company, and it's grown significantly since then, 5 years ago. Our team is ever expanding. We have Kerrigan, she's our veterinary technician, she's up in the back. So afterwards, they're all gonna be back there, so if you guys have questions, we're all happy to answer them. She's a veterinary technician, then myself, I'm a veterinarian. We have another veterinarian named Dr. Will Weiss. He's not here today. And then my husband, Ian, is a wildlife biologist. He's my parasite guru. So if you have any questions, he's gonna be available after. We also just hired another veterinarian, and he starts on June 1st. So we have a full team of people to assist you. A little bit, that one's harder to read, so this one's a little bit easier. So this is where we're going to be going today in my presentation. I know that parasites are not the most exciting thing to talk about, but I'm going to do my best to keep you interested. And these are kind of the areas we're going to talk about: foundation, resistance, what is it, getting to know the enemy, so what type of parasites we can have, the clinical signs that your animals may display if they have parasites, identification, how to identify what they are, how to kill them, non-chemical dewormers, and then management strategies. So we are going to basically be drinking water from a fire hose, which is a lot like what they say veterinary medicine is. So just know that this presentation is essentially Parasite 101, and it is going to be overwhelming, but I'm going to do my best to break it down as easy as I can, but this is really like a whole weekend worth of information, but you're going to get it in 45 minutes. Our goal is to not create parasite-free animals. We want to prevent clinical disease and economic losses. This is a slide where I sometimes lose people because they're like, well, we want our animals to have no parasites. That's not true. So we know that these animals can house parasites in their bodies and not have evidence of clinical disease. Our number of parasites will never be 0. So that's a target that we're never gonna get to. So you don't wanna do a fecal and be like, I want all my animals to be 0. No, I wanna have a low enough burden that I don't have clinical disease and economic losses. That means I don't want thin animals. I want animals that produce offspring every year. They don't have bad hair coats. They don't die of other illnesses. And there is a degree of parasite burden that we consider to be healthy. So this is a really important concept because this gets lost on clients when they see the numbers of their parasites on a fecal. They say, we have to deworm them because they have parasites, and that's just not true. It's not true in domestic species, and it is not true in exotic species either. This is just a slide to just say that we can't control everything. If we did, it would be a perfect world, and it wouldn't be fun to do this if it wasn't challenging. So there are some things that we can control in terms of parasites, and that's going to be our nutrition, what we feed them. This is a huge, huge new avenue that we're pursuing about the foundational components of animal nutrition and how that plays into parasitism. That's a whole talk in itself, but nutrition is key. You need to be feeding quality food. We know this. You can't just rely on just your grass and your forage. These animals need to be fed as well. Genetics, what you're bringing into your population. Stress, how can we reduce stress in their environment? And then pasture management. Do we rotate our pastures or do we just keep them all on 5,000 acres? Everyone's range is different as to how you manage your animals. There are some things that are outside of our control. We wish we could control the weather, but we can't. We can't control aging, and to the best of our abilities, we try to control disease, but we certainly can't control all of it. Intestinal parasites are the #1 health problem of small ruminants. This is true in domestic species, but it is becoming more true now in exotic species as well. It's a huge driver of economic loss in the domestic market, and we extrapolate a lot of information from there to determine what's going to happen in exotics. Sheep and goat, if you love sheep and goats, you love the pain because these animals are most susceptible to parasites. So if you have sheep and goats, you probably already know this. They're going to be your parasite burden animals in your herd. There are some exotic bovids, which we'll talk about later, that appear to be more susceptible to intestinal parasitism than others. These are going to be ones that if you have, you're going to want to take notes on that part. New drugs. We have the amount of drugs we have on the market is what we're going to have for a long time. There's no FDA push or regulations to come into play to help us get more drugs to deworm animals with. So what we have is essentially what we have. No new drugs are going to be coming into the United States anytime soon. Dewormer resistance is increasing across domestic species as well as exotic species. So this is an important concept that we'll talk about. A more integrative approach is going to be necessary. So we're going to have to move forward in our industry to be more integrative. And I know that we want to manage these animals as free roaming, but in some of these herds or some of these species, that's just not going to be possible if we want to have no economic losses from parasites. So the biggest component is going to be talking about resistance. So this is something that you guys have probably heard of, but I'm going to try to go into some more details so you can understand what it is and how it happens. It's not a myth. Here are some articles that I just wanted to throw up there to demonstrate that it is a well-documented fact that resistance is increasing across the United States. It's also really well documented in other countries, in New Zealand specifically. The southeastern United States is incredibly resistant to a lot of drugs here with parasites. We're following suit from Florida. Florida is by far and wide the worst, and we're about 5 to 7 years behind them, so we can kind of look at Florida as an example. So a lot of these studies are actually out of Florida. Specifically, these are ones in giraffes. So this is just to say if you have giraffes, you absolutely have to have an integrative parasite management program for them because they are very resistant to dewormers. What is resistance? So when we talk about this, I think people just think there's some super worm that exists in the animals that is just like dying to get out and rule the world. But in reality, these animals already have worms that already have a diverse genome. These worms have inherent DNA that already makes them resistant to our drugs. They're not mutating. They already have this genome, and essentially it allows them to survive a deworming, but we don't know that until we expose the animal to the dewormer. So it already exists within these worm populations, and what we do is when we expose these worms to drugs, they can survive that process, and then we are propagating a resistant parasite at that point. So your level of resistance genes increases when you have these parasites that survive. These are the most common things that cause resistance, and I think this is the part where people get upset when I say stop feeding fenbendazole in your food, but I'll get to that later. Because if you think about it, what causes resistance? If we frequently deworm our animals, so if you're someone who's like, I deworm my animals quarterly, or if you treat all of your animals, so you just say, I put it in my food and I feed it to everybody, you underdose. How do you know which animal is getting what amount of food, or if they're even eating the fenbendazole in a high enough amount to be getting dewormed? How much fenbendazole is in this food? Do we really know? We've had it analyzed. We know that it's not necessarily always the amount that we think that we're giving. So if we want to prevent resistance, we need to stop doing these three things first and foremost. There are a lot of other things we can do too, but this is the point to drive home, is that we need to stop doing these things. Refugia, so this is the proportion of the population of worms that is not under selection by the drug. So think of refugia as refuge. These are worms or parasites that are in refuge. So this could be inside your animal, this could be in your pasture, or larvae inside the animal. Essentially, it just never has been exposed to the drugs. So it's in refuge. This is the most important concept for parasite management moving forward in domestic species as well as in exotic species. And we'll talk about why that is. So I love examples and I like using clip art. So this is a Markhor clip art, and he has parasites. And so our blue parasites are gonna be our susceptible worms. So that means that they are going to be killed by the dewormer that we give. This guy also has some resistant worms, and so his resistant worms are the red worms. When we give this dewormer, the susceptible worms will survive, the susceptible worms will die, and the red worms will survive. So we deworm him, his parasite burden goes down, and his next generation of parasites are these red worms. So that is phase one. Okay, so we now know that this animal, the worms that are left, are worms that did not respond to our dewormer. So what we do on our ranch affects when we purchase this animal. So ranch number 1 dewormed everything in their pen for several years at 3-month intervals without using any selective measures of treatment. So they just said, we deworm quarterly, we just give it to everybody, and that's what we do. So we're gonna put our new Marcor friend in this pasture with these worms. And now our dewormer isn't gonna work because all of them are resistant to that drug. And maybe they will respond to a different drug, but this drug can now no longer be used in this herd or this population of animals because it has been overused. The second ranch listens to Dr. East and only deworms animals in the pens that need it. That's by fecals, or they look at their eye color and they determine which animals need to be treated. So they don't treat everybody, okay? So they just treat the animals that they know need it, or they do it based on selective treatment, knowing what animals may be more at risk. Now we're gonna take our new Marcor and we're gonna put him in this pen. And what happens is his resistant genes are gonna become diluted. So you think you're breeding Marcor, but you're really breeding parasites. So you need to think about this concept of when you're putting this animal in your herd, you want to make sure that the animals that you have these diluted genes so that you can dilute out a resistant gene to not propagate this further. So if you think about when you're deworming frequently, you're going to put your animals into a pen where you may not have a dewormer that's going to work for you anymore. But this group, you can, because it's going to dilute out that resistant gene. So getting to know the enemy. So how do we know what we have on our property? You can tell a lot about a parasite by where it likes to live and the disease process that it causes. They can live everywhere, but the 3 most common places that we see GI parasites are going to be the abomasum, which is the true stomach. Your ruminants have 4 stomachs, they're chambered. The abomasum is the glandular true stomach, and this is where some of the parasites like to live. The large intestine, which is like the cecum, and some parasites that live there, they cause diarrhea and GI disease. And then we have small intestinal parasites. So this is just to tell you that based on where they live, this can tell us what their disease process is and what to look for. I'm not going to make you memorize this slide. This is just basically to tell you that there are a lot of different names, a lot of different places, and a lot of information about which worms affect what animals, as well as at what stages of life. So a whole parasite lecture in itself, which I'm not going to give you. When you leave here today, you're never going to forget this worm because it's horrible and it's basically what is going to keep you up at night. You thought Brian's talk is going to keep you up? This one is definitely going to. Homuncus is the most prolific parasite on the planet, and it is a huge problem in domestic species and is becoming a very big issue in our exotic species. It's called the barber pole worm because in the picture you can see it has this red and white stripe that looks like a barber pole. And it is a blood-sucking worm. So what this parasite does is it attaches to the abomasal wall, so the stomach wall, and it sucks blood out of your animal. And they're extremely prolific. So one female can produce 5,000 eggs per day. So I wish we were breeding homuncus and not super exotics because they're incredibly prolific and they survive a long time in the environment. They have dewormer resistance. So essentially, homuncus has become resistant to almost every anti-helminthic that we have on the market, so getting rid of it is extremely difficult. It has a very short life cycle, 21 days, so that means it propagates very quickly. In the southeastern United States, or anywhere that you see heavy rainfall, this is where you're going to see this parasite proliferate, which is why we don't really have a lot of exotics on the coastal parts of Texas and Louisiana, because you'll see a lot more parasites there. This is public enemy number 1 for small ruminant farmers, but also for exotics. 1,000 adults are responsible for greater than 3 tablespoons or 50 mils of blood loss per day. So you can imagine that by the time these animals have this parasite, it can kill them pretty quickly. The big thing to know is when an animal is infected with homuncus, they're losing blood, so they're anemic. They do not have diarrhea. They do not have weight loss. They do not have ill thrift. They just die. So a lot of people say my animals don't have parasites because they don't have diarrhea, and that's not true. You cannot know just from GI symptoms if your animals have parasites or not. So a big important note is there are some parasites that cause GI disease, but not all of them do. So it's not something to just drive home. We had a client who saw this presentation and did a necropsy on a sable and sent me this photo, and I was very proud because he was able to diagnose what his problem was very quickly. You don't always get this lucky when you do a necropsy, but in the right-hand side, it's not great on that one, but it's better over here. You can see this red mat of stuff. So he pulled that up and looked at it, and you could actually see it's like a mat of homuncus. So this animal obviously died from like a profound anemia, secondary to a high parasite burden. If you look really, really closely on these slides, this is just to demonstrate that it can be hard to see. So if you're doing your own necropsies, you just need to be really careful and look very closely at all of the details or have a pathologist or a veterinarian do them. These are very hard to see, but these are barber pole worms on the wall of an abomasum of an exotic animal. There is a special test that you can send off to a laboratory. A&M actually has one now. It's called a corpora culture, and basically it's a fancy word for hatching out worms in poop, and they identify what they are. The downside of this test is it takes 3 to 4 weeks to perform. So if you have a problem, by the time you identify it, you probably already know you have a problem. It's good to know, though, because homuncus lives in a family of parasites called strongyles, and you cannot tell them apart on a fecal. So that becomes problematic. If you think you have homuncus, you can't actually know that unless you do one of these tests. But if your animals are anemic or you have high parasite loads in animals that didn't have it before, it's a prolific parasite and it's likely homuncus. But getting that identifier is helpful to know how you're gonna move forward in treating that population of animals. So because it causes profound anemia, if you're looking for homuncus, you can look at the mucous membranes of the eyes. You cannot look at the gums. So when you're in the trailer, when you're trying to look, don't look at the gums. They always look pale when you look in the trailer or when you look at their gums. Look at their eye, pull down their eyelid, and look at the mucous membrane color. You can use a flashlight to help you if it's dark, but really this is best done outside. So there's a scoring chart that you can use, but essentially you want to look at their mucous membrane in their eye to determine if they're anemic. When you lose a large volume of blood, you also lose protein. And so animals can have bottle jaw, which is swelling underneath the chin. You'll call me and say your animal has an abscess. I'll ask you for a picture, and I'll say your animal actually has bottle jaw. So it looks like an abscess, and you'll think it's an abscess. But if you were to touch this, it's normally you can push it back. It's like edema almost. And it's because they're losing so much protein that it actually looks like they have a bottle jaw underneath their jaw. So these are the animals that we see that are primarily affected by homuncus. So something to note if you have these animals on your property, mark where just basically all sheep and goats. If you have sheep and goats, then homuncus is going to be your enemy. Sable, for some reason, are very susceptible to homuncus, and it appears to affect them significantly. And giraffe are our biggest problem with homuncus, and then blessbuck as well. Blessbuck do also seem to have an issue with copper deficiency, so when they look kind of that off color, that's not that dark color, they may be more prone to getting parasites because their mineral status is not in balance. So that's something that we have come to realize over the last couple of years is that minerals play a big role in your ability to fight off parasites. Whipworms, these live in the large intestine and they can cause diarrhea. Very important for giraffe. There are other species that are affected as well. But this is just to note that this is one that does cause GI disease. It doesn't shed all the time in feces. So when you see this on a fecal exam, it's important to note it because they shed intermittently. So just seeing it on the fecal, if you just see one or two, it doesn't mean they don't have a high parasite burden. So this is just to show you that diarrhea is the most common clinical sign. If you have trichuris, you can also be non-clinical, meaning you have no clinical signs whatsoever. Giraffe are susceptible. Camelids are extremely susceptible to trichuris. And then we had an incident with some Dama gazelles where we lost a large number of animals in a herd to trichuris, which we had previously not known that Dama could be susceptible to that. On a necropsy, this is what they would look like. They're a little bit easier to identify than a barber pole worm because they're larger. They're translucent looking, and they have like these whips on the end of them, hence whipworm. And that's about the size they are, and you can see on the left-hand side. So important note to when you're doing a necropsy to take careful notes and details of any parasites that you see. Coccidia can cause profound diarrhea. It's a whole talk in itself, but mostly sheep and goats. Other diseases cause diarrhea, so just because it has diarrhea doesn't always mean it's coccidia. But if you have a sheep or a goat, a kid, a lamb that's at weaning age, it's stressed, and it has diarrhea, you probably have coccidia because that's the most common cause of that in that animal. In significant amounts, coccidia can cause neurologic disturbances. There are a lot of other diseases that cause it as well, but just note, this is an animal that came into a clinic I was working at, and it was neurologic, and I'm like, oh my gosh, it has polioencephalomalacia or something like that, and it had horrible coccidia, and it caused neurologic disease. So important to note that it can, in significant amounts, cause other disease processes besides diarrhea. Meningeal worm, I get a lot of questions about this one specifically, so I'm going to touch base on it. Everyone thinks a neurologic animal has this, so I'll just go over the life cycle. You have to have a white-tailed deer, snails, and a pond. If you don't have all three of those things, you do not have meningeal worm. How the life cycle works is the parasite lives in white-tailed deer and causes no clinical disease, which is great for them, but terrible for everything else. So the snail, the water, the pond, that all plays a role in the life cycle. The exotic animals eat the larvae from the grass, and the parasite gets ingested into their stomach, it hatches, and then the parasite migrates into their spinal cord. Really, these parasites are just so unique and crazy with the things that they do. But yeah, it goes into their spinal cord, makes tracks, and essentially causes neurologic disease that is not fixable. We can give them medicine to try to help with inflammation and swelling. However, most of these animals eventually progress and die. And it's extremely hard to diagnose. You have to do a CSF tap, or you have to get your diagnosis on a necropsy, where you take spinal segments and have it looked at by a pathologist. The clinical signs include lameness, so they can just look like they're limping, gait abnormality, they're weak, paralysis, and then death. Other diseases cause this as well, especially trauma, and exotic animals love to traumatize each other. So just know that when you see this, it's not always meningeal worm, but it can be. So the important thing to rule out if you have the rest of the life cycle. Clinical signs of parasitism in exotic animals. So like I talked about before, a lot of times the clinical signs could be nothing. So you may see no evidence of diarrhea. You may not see anything. So important to know, I'm going to go over some clinical signs, but doesn't mean that you're always going to see them. FAMACHA, this was designed in South Africa. It's a scoring chart. You can get a scoring chart from the University of Georgia. If you go online and take their course, they'll send you one. It's a handy tool to look at the degree of anemia. Really better for sheep and goats. I don't necessarily know that it works as well for other exotic species. Just an example of using a FAMACHA chart to look at degree of anemia. The one on the left is a sable that had like 17,000 eggs per gram homuncus and ended up dying even though it had a blood transfusion, all these things. So that's how white that animal was. It had like no blood left. Its hematocrit was 3, and I think normal is like around 35%, and it was 3. So significant blood loss. Giraffes, for some reason, when they get homuncus, they will oftentimes get bottle jaw. It's not in all giraffes that have it, but it's enough that I feel like it is a clinical sign that I would look for in a giraffe. So the swelling under the jaw and people saying they have an abscess when really it's protein loss. It may have something to do with their blood circulation because of how large they are, but for some reason this species seems to get a bottle jaw more often than others. In juvenile giraffe, you can actually look at them and say, I think you have a parasite problem because they have poor body condition, the parasite sucks a lot of nutrition from them, and you can sometimes look at them and just say, you don't look well. So these animals, you could see in this animal's thin, its hair coat is dull, and it had bottle jaw, which was helpful, but it had a high parasite load. This animal did survive. Another poor body condition, so again, when you see these in giraffes, or if you have a giraffe juvenile animal, they are more prone to parasites than adult giraffe. However, it seems to be uniform across giraffes in general that they have a big issue. The bongo on the left had severe pneumonia and then also got a secondary whipworm infection. It's a very thin animal, not very common for this species to look like this or to be thin. So this animal had a nutrition problem, which contributed to its pneumonia and then obviously to its parasites. This animal did survive, but just to note that they can have other clinical syndromes that lead them more susceptible to parasites as well. The one on the right is a sable that had chronic bloating, secondary to ruminal acidosis from severe parasites. She battled this for a very long time, and she did have a couple more calves, but eventually she died from this condition. This is an Arabian oryx that was humanely euthanized because she was a typhoid Mary. She was extremely poor condition, very old, could not. Every time we dewormed her, she came back high with parasites no matter what we used. So we elected to remove this animal from the population because she continued to contribute high numbers to the herd. And so we ended up euthanizing her because it wasn't worth the risk to the rest of the population. Sometimes the only information you get is on a necropsy. So these are pictures of zebra necropsies. They like to get roundworms, which we didn't talk about, but it can cause fatal impactions or torsions in equids. We don't talk enough about zebras, but we do see significant parasites in them as well. All of your equid species are going to have tapeworms, so everyone gets really excited when they find tapeworms on the necropsies, and they're like, they died from tapeworms. It's really unlikely for the tapeworms to be the cause of death. Usually it's just incidental. So in rhinos, tapirs, and any equid, you're going to see tapeworms in there. It's pretty unlikely that they cause disease or significant amount of disease to cause death. How do you know what type of worms your animals have? There are two different measurements or two different ways. There's lots of different systems, but you have a qualitative analysis and a quantitative analysis. Qualitative means somebody puts an unknown amount of poop into a tube and they float it with some solution and they stick a slide on it and then they look at it under the microscope and they'd say 1+, 2+, 3+, and they give you this subjective measurement as to what they believe the parasite burden on that slide is. If I did this test and I had my husband do this test and all of you in this room do a qualitative test, we would all say a different number. So it's hard for me to read these numbers when I'm given them and know what it means because it's subjective. Whoever's reading it is the person who gives that number. And it's not repeatable. So it's my least favorite test. And if you call me and tell me you have this, I'm going to say I don't know what it means, but I'll do my best to try to help you. A better test is going to be a quantitative analysis, which is called a McMaster's. This is a counting chamber. They weigh out a gram of feces, they mix a solution, they put it into this chamber, and then you count the number of parasites that you see in the chamber, and you do a little fancy math equation, and you get a number, and that number is a quantitative measurement of the amount of parasites per gram of feces. It is repeatable, usually within 10% margin. So this is something that I could do, my husband could do, and we compare our notes and we get around the same number. So when you're asking your veterinarians or your staff to do a fecal count, you want to make sure you're getting a McMaster's done. So write that down. So if you don't live, if you live somewhere where you're using a local vet service to do your fecals, you want to request a McMaster's test on them. The different types of parasites you can see on a fecal vary. Like we said before, strongyles are the most common, homunculus being a strongyle. You cannot tell the difference between homunculus and other strongyles, which is unfortunate. So just a drive-home message, you're not going to be able to say I have homunculus unless you're going to grow it out and check for sure. Coccidia is really small. You can see that on a McMaster's or fecal float. Whipworms look like little footballs. And then tapeworms are disgusting, but they don't really cause clinical disease. And Pierre Davids are like the harbor for tapeworms. They are just gross animals. So you'll always, all they do is sleep in the water and poop in the water and drink it. And they love to get tapeworms. It's pretty gross. So this slide makes it look really easy, right? I give you like these beautiful pictures and I'm like, oh, it's so pretty. Like you can all look at it and see what it is. This is what it really looks like on there. And Amber's laughing because she knows. Because you look at these on a slide and you have to differentiate what is cellular, like what is debris, what is water, what is plant component, what is fecal matter, what is pollen, and what is parasite. So I say that to you really have to have a trained eye to look at these, and I'm not saying that owners aren't capable. I'm saying that you have to have a lot of refined practice in looking at these slides to know what is parasite and what is not. Because it is very easy to look and see water droplets and say, is this a parasite and we have a big problem, or pollen? Because I mean, that thing on the bottom right, you probably all looked at that and were like, whoa, you have a parasite problem. That's pollen. So this is just to show that it's very complex to look at these, and sometimes if you don't know what you're looking for, it can be hard to determine what's a parasite and what's not. This is easy to determine. I know I said I don't do floats, but if I have a really sick animal come in and I just want to know for sure is it parasites, I'll float it and look. And these animals did not survive, because if you see this on the slide, you've got a bad problem. The importance of a post-treatment fecal, I added this slide from my last time because I don't think I drove this point home enough, is that it's one thing to deworm an animal, but then how do you know that it worked? So we all feel better, right? We deworm them and we say, yay, go us, we dewormed our animals, let's go to sleep at night and we're gonna make lots of money. And we don't know. We go to sleep at night, we don't know if our dewormer worked unless you're checking it 14 days later. I know that's hard to do in a lot of these species, but just a point, and this is a great example. We dewormed these 3 sable, and we got post-treatment egg counts. Sable number 3 did not respond to our dewormer. Did this animal not get the full amount? Is it resistant to the parasite or to the drug that we used? Like, you need to ask yourself, so this animal is at risk of death, but if we had never checked, we would never know that it didn't respond. Greater than 90% is what I shoot for. So really, sable number 2 is a problem too, but the parasite load was low enough that we decided to ignore it for now. But sable number 3 needed to be dewormed again because there's something that animal did not respond appropriately to that dewormer. Giraffe, this is a fun tale of a giraffe. Spoiler, she lived. How? I don't know. So before we were involved, this animal had a 7,900 egg per gram treatment, fecal egg count, was treated with just fenbendazole. They are somewhat resistant in this area to fenbendazole, so it did not work. So her post-treatment fecal was 10,300 eggs per gram, and I'm thinking, oh shit, like this is terrible. We need to do something different. So we decide we're gonna give fenbendazole and we're gonna give Sidectin and fenbendazole together. We get her number down lower, but not low enough she's still at risk of death. So we decide we're going to give her levamisole, which we'll talk about drugs in the end. It's like a last-ditch effort, very difficult to get into giraffes because it tastes horrible, and we got her down to 950 eggs per gram. This animal will have a constant battle with parasites forever, but if we had not done these fecal egg counts to check, she would have died, and that has happened before, where someone will deworm an animal and not check. And if we're not checking, especially in these super, super expensive assets, you could lose an animal and just not know, just out of pure lack of knowledge, not for lack of care. So now that we talked about that, we're going to talk about how to kill the enemy. So we're going to go into our dewormers, what they are and how they work. I'm not going to really go more into the mechanism of action, but just know that the way the different families work is different. So that makes sense. All of the families have a different mechanism of action of how they kill the parasite. So that's what differentiates the 3 families from each other. The dewormers in each family work by the same mechanism, but they have a different affinity for fat. So there are different drugs in the families. So this is the benzimidols, which is your white dewormers. So we're all pretty familiar with Panicure, Safeguard, and Valbazen. The important thing to note on this slide is if you're utilizing Valbazen, it can cause abortions in the first trimester of pregnancy. So if you have an animal that's unknown bred or you're in a breeding season and you know these animals are starting to breed, it may be worth the risk to deworm that animal because the mother survives, but she may have an abortion, and you may not actually see evidence of that. But just important to note, if you're utilizing this drug, it does cause abortions in the first trimester. The nicotinics, so again, they work by a different mechanism of action than the first group. You have levamisole, Marantil, Strongit, and Rumantil. Levamisole is probably the last drug we'll ever have that really works right now in exotic species. It's my last resort that I would ever use. And the reason being is that it has an incredibly thin, narrow margin of safety. So that means if you don't know what your animal weighs, or if you decide you're going to go 2 times the dose, your animal's going to die. So it has a very, very narrow margin of safety. So when you're using this, you want to be very careful with how you're administering it. I've heard stories of people putting this in their water, and it's a very fast way to lose money. And then you're not in exotics for making money, you just lost a lot of money. They'll put it in their water, and you don't know how much these animals are drinking, and you have a really high probability that some animal is going to come take a big chug of this, and possibly more animals than that. So I would never recommend putting this in the water or in the food. So it makes it hard to utilize for our purposes, but it can be really dangerous. We're all familiar with these drugs. So our macrolytic lactones, which is your avermectins, ivermectin, doramectin, Eprinex, and moxidectin. So the difference between these two groups, they're like cousins. They do the same thing, but they just have a little different affinity in the animal's body. Topical dewormers do not work. So do not use the porons. We've now proven in domestic species that this doesn't work. It doesn't reach a high enough level in the bloodstream to actually deworm. And at best, you are not treating, and at worst, you're creating resistance. So poron topicals do not work. It would be great if they did, because it would make it a lot easier to treat our exotics, but it doesn't work. So unfortunately, it's a no-go. I lied to you earlier. There is a new drug, but it's not available in the United States, nor will there be a possibility. I gave this talk with this slide 2 years ago. There's still absolutely no evidence to support that this drug will ever be available in the United States. It was created due to a problem with resistance in New Zealand. So this just goes to show that when they reached that point, they were able to develop a new drug for this. But to get it over into the United States would require an extreme amount of testing by the FDA, and there would have to be a big push from the domestic market, so sheep, goat, cattle, and unfortunately that just doesn't seem like it's going to happen. So who knows, maybe it will be available one day, but as of right now, I would say it's not. Coccidia treatments, there's a lot of different ones. Everyone's most familiar with Corid, and there's also Panazerol, Tiltrazerol. If it ends in IL, it's most likely for coccidia. Some of these are limited availability in the United States, and you have to give them orally. Cord is the one that you can give in the water. However, if you give a large amount of this to an animal that has coccidia, you can cause a thiamine deficiency. So just be aware. If you're giving, some people go off-label and they do like 2 or 3 times the dose of Corid. If you're doing that, you probably should go ahead and give some thiamine as well. Coccidia can also be prevented by measures in the food or in the water. However, you can't do this once you have the problem. You have to do this before the problem. So you want to make sure, we know when this happens is at weaning or at birth. When these animals are in a heavy lactation, pregnancy, a high level of stress is when you have the problem with coccidia. So you want to time how you're treating prior to the stressful event in that animal's life. I get a lot of questions about non-chemical dewormers, so I'm going to hit these pretty quick. There's 4 that I most commonly get asked about: diatomaceous earth, tannins, copper oxide, and the last one is a very fancy name for a fungus that I don't know how to pronounce. So we'll go through each of these quickly, and I'll tell you what people say they do and then what they really do. Diatomaceous earth is one of my favorites because everyone says that it works to deworm animals, but it doesn't. It just makes you feel better. Maybe it dries their poop out, but it does not work and it does not deworm your animals. So people love to give you this one about feeding diatomaceous earth to your animals. Great. Do it if you'd like to. It doesn't work. It's not doing anything. So you can feel better, but it's not actually deworming them or doing anything to reduce parasite burden. So there's no studies to support this. Does it hurt? No. Does it help? Probably not. Tannins. This is one that I like to read about a lot whenever I'm bored because I think it's going to be really cool when it comes to fruition. So the claim is that it decreases intestinal parasites. Most of the studies on this are being done in South Africa, so some of these species of browse are native to there. If you know anything about tannins, they're produced by trees, and in high amounts, they can cause toxicity, but in low amounts, apparently, it can help with parasite burden. And we need to know more about this before we can apply it, so I think we let the domestic side kind of take the reins on this first, and once they have proven that it does work, then maybe this is something we can extrapolate from and use in exotic species. So we need to know more, but it is certainly an interesting concept to be able to feed a pelleted food with this in it that can help reduce parasites. This is what it does to the parasite. The one on the left is healthy. The one on the right has been given this tannin food, and it basically makes it to where they can't eat or have egg secretion. So essentially, it hinders the parasite's life cycle. This was a fun study that was about using it to control coccidia, but they also use copper. Or not in this one. This one, they just used the pelleted food, and they did see a marked difference in gastrointestinal parasites in these animals. Copper oxide wire particles, this has taken a lot of ground in the last couple of years in the exotic market. So it's copper oxide. A lot of you are more familiar with copper sulfide. This is a different type of copper. So different mechanism, different way of working. They come in little capsules. And the important thing to note is that the only parasite this appears to work for is Homunculus. So it doesn't work for other parasites, but it does have an effect on Homunculus. It's not to be used alone. It can be, but it's not a dewormer. It just helps dewormers kill parasites better, but it can also help decrease parasite burden in animals that don't have a really, really high load. So we use a lot of this right now in giraffe, and we're also starting to use it more in sable. Just know that when you give anything like copper, you just don't know what these species are tolerant to. So sheep, we know, are sensitive to copper, so you probably shouldn't give this to sheep. I will say that we've done it in low amounts and it's been successful with no issues, but we don't know if other exotic animals are sensitive. I did a whole research study on this at the San Diego Zoo Safari Park, and we did find a couple of species like Gerenuk were really sensitive to copper. So we don't know enough about the other species to know if that's true, but there could be some variants that we don't know about. This is what it does to the parasite, just messes with the membrane so they can't absorb nutrients. Some awesome papers out of Fossil Rim. Fossil Rim is really a spearhead in the industry as far as what they're doing to help mitigate and manage parasites. So I looked to them a lot as a resource, and I talked to them a lot. And they are kind of spearheading some of these things in the exotics industry with some other zoos like Disney and Busch Gardens, because they're the free-ranging zoo parks that have animals that we have in the private sector. But I certainly think there's room for us to kind of do some of these things as well. We have way more animals than them, like Brian said, so maybe we should be spearheading some of these studies and find out what's going on in parasites and how we can treat it better. The fungus, this stuff is awesome. Spoiler, it's not available right now. It's on back order again. I feel like every time I get up here and do this talk, it's on back order. We checked before, like I think a week ago, to check and see, and it's still on back order. Basically, it's a fungus. You feed it's like it looks like cotton almost, and you feed it as a top dressing on your food. And it's not a dewormer, but what it does is it prevents the parasites from hatching out of the poop. So it decreases the fecal shedding in the environment, which therefore decreases the amount of parasites your animals ingest. Hopefully, it says it's going to be available again. There's another one. I put them both on here because important to note, there's a biowerma and there's a Livamol biowerma. It's not levamisol. It's a weird diluted product of biowerma. So you have to feed 3 times the amount, which costs you 3 times the money, and the palatability sucks. So the animals don't like it. And so you can get it if it's the only thing available, but just know that the palatability of it appears to be poor, and you're going to spend more money on that product versus the BioWorma. So when it comes back on the market and you guys all buy it out, I'm going to be really sad. But we keep checking to see when it's coming back, so that we can hopefully hold some for people when they need it. This is our parasite season right now. So this is really when we really need this stuff, which is not available, unfortunately. It comes from Australia. So my husband's Australian, so we'll see if we'll put him on it. So these are just studies that also demonstrate the use of the fungus in food to essentially trap the parasites and decrease shedding in the pasture. This is some cool pictures they took of what it does. So the one on the left is a normal parasite hatching out of feces. The one on the right had the nematode trapping fungus, and it basically trapped the parasite and it's not able to shed in the environment. Management strategies to consider. I've already talked about some of these, but just to kind of drive them home again. Inconvenient truths are better than comforting lies. So a lot of you have been told to deworm quarterly in your food. And I think a lot of us want to know, if I can tell you you're going to spend X amount of money, you're going to deworm your animals, and you're going to feel better, now you're going to go home and say, well, I'm not going to be able to feel better about that because I now know this information. And information is power. So a lot of people are doing this not because they don't know better, it's because they've been told this. So I'm here to tell you that it's an inconvenient truth, but feeding fenbendazole in your food significantly contributes to the resistance on your property. I'm not saying that I won't ever recommend you do it, because there are times I have recommended ranches do this, but if you're already utilizing it in a situation that you don't need to, you may have already created a problem for yourself. Some people will tell you, I feed fenbendazole in my food, and I don't have a parasite problem. And I'll say, how do you know you don't have a parasite problem? Maybe they never had a problem to begin with, and they just are deworming their animals for no reason, but they didn't know because they've never taken a fecal egg count. If you're deworming, well, just for example, I rarely, if ever, see parasites in kudu and bongo. If you're feeding fenbendazole to kudu and bongo, and you create a resistance, and then you get a whipworm problem, and I need to give them fenbendazole, it's not going to work. They didn't need it. Kudu and bongo rarely ever have parasites. So don't waste your money trying to protect your asset and then actually end up hurting yourself in the process. So all that to say, no one ever wants to stand in my line of unpleasant truths, but it's the truth, and the research supports that this isn't a good practice. Because when we talk about resistance, these are the three things that we need to do less of in our industry. Management tips, the 20-80 rule, 20% of your herd sheds 80% of your parasites. Your whole herd is not a parasite producing machine. You usually have one or two animals in there that are going to do the job for you. The rest of the animals aren't going to be affected. So these animals, if you can identify them, they're reinfesting your herd on a regular basis. If you can figure out which ones these are animals that you can keep a better eye on if you know who your typhoid Marys are. I love when you guys call me to knock down a whole herd of animals because it gives me a lot of information. So I went and knocked down this whole herd of sable to move them. And this is actually during peak parasite season. Could not have wrote this better myself. 14 animals, and only one animal in the whole population needed to be treated for parasites. We ended up looking at a couple of their eye colors. We ended up treating a couple that didn't end up needing it, but we didn't treat everybody. So we still have refugia, so we still have refuge from the drug in the animals that we didn't treat. But this is a great example of animals that didn't need dewormer, that if you'd put it through your food, you would have created resistance when really you have one animal that needed to be dewormed. Management tips, if you're gonna deworm, if you need to, certain drugs do better if you fast the animals, so you fast them for 24 hours and then you feed it to them. So your benzimidols, all your white dewormers, or anything you put through the food, and your ivermectins. When you're doing fenbendazole, you repeat the dose in 24 hours. Some people do it for 3 days, some people do it for 5 days. If you have giraffes, this is a whole parasite presentation in itself, but basically decrease the amount of feces, not by decreasing their food, by picking it up in their environment. Decrease their grazing. They're not grazers. They're not meant to graze. And that's how they're picking up this parasite. So you want to increase their ability to browse by either cutting browse or offering browse, or increase their enrichment by decreasing the amount of food you're offering, but giving it to them more frequently throughout the day. There's a whole army of people out there that are propagating this new method of giraffe care. So if you have giraffe and you want to talk about it, it's one of my favorite topics. But this is kind of new information, new research being produced from zoos and private owners that we need to do a better job at managing these animals because they're worth a lot of money and they're no good to you if they can't produce because they have high parasite loads. We get fecals from giraffes with parasites every single week that need to be treated that are dangerously high. So this is a real problem in giraffes. Another old wives' tale is to rotate your dewormer. People at the feed store used to tell you this. It's not true. You're just creating resistance faster by exposing your worms to a bunch of different drugs. So if you want to create resistance faster, you can do this, but rotation is not a good replacement for proper resistant prevention measures. Drug combinations, we use this in resistant animals or in parasite infections that we can't get rid of. It's dangerous if you just do it to everybody, and it's dangerous if you don't know why you're doing it, but you want to make sure you're doing it in different families because the whole point is to use different mechanisms to kill the worms, but if you hit them with the same mechanism, you're not really helping your cause with the parasite issue. You need to hit it with two different ways to kill the parasites. So very important in sheep and goats. This is something that in domestic species, when you get a new goat in, you would hit that new goat with a double dewormer, like two different kinds. You would quarantine that animal for 14 days, and then you would put it out in your herd. This is not something in the exotics industry that we can do easily, but I'm just saying that from a management standpoint, we maybe need to start asking ourselves the questions of how are we going to introduce new animals to our populations and ensure that we're not introducing new parasites. These are all the places that we've been and talked about. So we've drank water from the fire hose together. I've overwhelmed you, I'm sure. And Brian convinced you to invest, and I probably made you take a step back and say, well, we need to understand a little bit better about how to manage these animals appropriately. And I think that's the importance of this talk, is to make sure you have some foundational knowledge and understanding of what's going on in your herds before you continue to move forward. I'm going to go over 10 quick things. The color's not great, but so run fecals frequently to identify if a problem exists and what type of intestinal parasites your herd has. I'm talking 6 to 10 samples of a herd. You don't have to sit there and watch every single animal poop. We have some people who do that. You'll say, well, I don't know where they poop, or you just sit there and watch them and one day just sit and watch and collect. I say frequently because oftentimes I'll get people that want me to come out and do a one-time kind of spot check. Parasites are ever evolving, ever changing with the seasons. So I could come to your place tomorrow and say, hey, good news, your animals look great and you have no parasites. 6 months from now, you could lose your whole herd to parasites, and my one spot on your map did not prevent that from happening because you have to run them frequently to identify what the levels are, and when you start to see a problem, monitoring to know what you need to do. So this may mean that we need to more intensely monitor our parasite levels in our herds, and maybe that restructures the way that we manage these animals in captivity as well. Don't deworm without knowing what your pre-treatment egg count is, because if you treat at 2,000 and the fecal comes back and I don't know what the pre-treatment was and now it's 1,500, I don't know. I don't know if it worked. I don't know what dewormer to use now because I don't know if your dewormer worked the first time or not. So then again, checking in 14 days if you can. Sometimes you don't know which animal it is or you can't find it, or you have a 1,000-acre property. So I say all this to say I know that managing these animals is difficult, and I'm not saying you need to go out there and do these things. It's just these are best practices if you can do them. Tagging individual animals, I added this one in there because you'll give me a bunch of fecals and then I'll say, wow, someone in this group has a high parasite load, but I don't know who it is because we don't have tag numbers. So if you can tag a population of animals, especially sable, I will say this has helped us significantly identify in a sable herd who the problem is. We have a client that has about 30 sable, and they collect fecals on them every other month basically, and they give us every single number of the animal. And we treat the one animal that needs it. So it is possible. I'm not, obviously they have more people more time, but just this is the best way to do it if you're trying to keep track of a certain population of animals to know who has parasites and who doesn't. Only give copper with a veterinary advice and recommendations. It can be dangerous. You wouldn't see an issue the first time you gave it, most likely, but as you continue to expose the animals to high levels of copper, you can get into issues. If you're using copper in your herd and an animal dies, even if it's gored or some other cause of death, check a mineral level on your liver. You can send off a piece of the liver. You can have a mineral status checked on it. Just make sure your copper is not causing an issue. We personally haven't seen it, and the research institutions that have been doing this haven't seen an issue, but you certainly want to know if there is a problem before it happens. If you can clean out feces in enclosure, I'm not saying go clean your feces out of your 1,000-acre pens. You're going to look at me like I'm crazy. But if you have a small pen of animals, giraffe especially, if you can clean out the feces every day for a giraffe, you will not have parasites. I'll put my money on it all day, every day, because it's been proven. If you can remove feces from the environment of a giraffe, they will not get parasites, because that is how the life cycle propagates. So if you can clean up the feces, it's great. Obviously, a lot of us manage these animals on 5,000-acre ranches or 200-acre pens, and it's not feasible. This is just to say that's a really important part of the life cycle. Don't underdose on your deworming. You want to make sure you're kind of using an accurate representation of the weight of the animal. Don't rotate your dewormers after each treatment. Don't treat every single animal. And consult your veterinarian for assistance with proper parasite control. So thank you guys for having me. I know we talked a lot about some in-depth topics, and we just basically overwhelmed you with information. But we're happy to be a resource. We're happy to help. We want to make sure that you're protecting your asset as well. So please come find us if you have any questions. We'd be happy to help you guys. So thank you very much for your time.